The progress that has been made over the last 12 years is breathtaking. No one thought we would be here today with the significant reduction in new infections, the significant expansion of antiretroviral therapy, and the care for orphans and vulnerable children. There isn't a silver bullet in why we got to where we are today, and there isn't a silver bullet in how we're going to go forward. That's true of the scientific advance, that's true of the epidemiology, that's true of the political commitment. It's everything. If there's one thing that underlined it all, it was vision and partnership. And that's why we've gotten to where we are today. And a fundamental shift in how we view development. The paternalism of the past, the notion that the people in the North and from high-income countries have the solutions that they would bring to countries in Africa and other low-income countries is just nonsense. It's always been garbage. But now we have proven it's garbage and have moved on from that paternalism to a full partnership that puts the countries in the lead. Well, the commission that's been put together by UNAIDS and Lancet is an extraordinary opportunity. It brings together very high-level people from across the spectrum of health to look at the future and what's possible and how we move from the significant response to HIV/AIDS that's revolutionized how we look at health, how we support countries to achieve objectives that people said were impossible 10 years ago, and extend that beyond HIV/AIDS, to use that platform so that we can have a healthier world. So the Commission is really looking forward, looking backward at what worked, what we can learn, and looking forward to what we can take forward, not only for HIV/AIDS, but for health more broadly, to have health and well-being as a major part of what we as a people do going forward into this millennium. We are on a significant downward trajectory of new infections. And so we can drive that downward trajectory all the way to control if we're smart and if we use the science and epidemiology and the experience we have and focus on the hotspot. If we lose this moment and infections begin to rise, we lose that opportunity. And then we have HIV for generations because we have no science on the horizon that we can see today that will tell us how we'll get past it if we're on the upswing. So it's the opportunity for a generation. It's the opportunity of this generation. And we really have to ask ourselves, do we want to be the generation that sees that historic moment, that ended the modern day Black Plague? Or do we want to be the generation that tells our children and our grandchildren that we let it go and they're still dealing with it because of it?